Hey, welcome back. I'm Ryan Bober, a doctor in New York City. I practice internal medicine, and today we're going to talk about something that you probably never heard of before. COVID-19. Just kidding. I know it's all over the news. You probably can't get enough of it through social media, but I've been working in and out of different clinics and in a hospital at the center of the pandemic in the world, and I think it's important to distill down the most essential ideas of what we know now, because it's different than what we knew before, and what you can expect with some important questions as we head into the summer. So here's the most important facts that you need to know now about COVID-19. Number one, summer, finally. We've all been waiting for this for so long. You've all been doing your part in quarantining, and now you're going to do your own personal part in wearing your sunscreen as you go outside. But as we do this, and as we have been longing to see our friends and our family, and we're going out into the community, we can't forget that there are still tens of thousands of people that are getting COVID-19 every single day, and this is just in the United States. And even though the economies are starting to reopen and businesses are getting back to normal, we still have to maintain our vigilance and prevent community spread through social distancing. Number two, transmission. So we all know that respiratory droplets are the predominant mode of transmission from person to person, and this is what is propagating the community spread. Importantly, respiratory droplets, as you know, they tell you to stay 6 feet apart because that's the typical distance that the droplets will travel, and that's the distance that you need to stay apart from somebody in order to prevent the transmission or to get some of their particles that are carried in the droplets out of their nose or out of their mouth. But if you're talking at a louder than normal volume, or you're coughing, or you're sneezing, or you're singing, for example, then you can transmit the droplets beyond 6 feet. So if you're in those scenarios and you're in a situation where there's lots of people around, please be careful and maintain an even greater distance, if you can, to prevent both community transmission and you contracting or one of your loved ones contracting the condition. What do we know about transmission through surfaces? We touch lots of surfaces every single day in the community. Some of those may have been exposed from someone else in the past with the coronavirus. And we do know that the virus can last up to 6 days on different surfaces. So the most important thing is that whatever you touch, whether it's your keys, your phone, your wallet, or your watch, that you wash your hands before touching your face after touching those objects. So if you are going to wear gloves, that's okay if you want to do that in the community, but just know that if you wear your gloves and someone calls you and you pick up your phone, you're contaminating both your phone and potentially your face by having the glove that touched something else in the community. So be very vigilant and make sure that you're washing your hands frequently every time you unglove and before you glove as well. Another common question that comes up is it possible if I have coronavirus for you to get it from me if I've never had any symptoms? And unfortunately the answer is yes. 1 in 5 people will have a positive nasal swab test for coronavirus, but will never manifest any symptoms. And this is a route of transmission in the community that is very prevalent and is important in the role of propagating the spread. So we have to be vigilant, and anybody who's had even an exposure, we could consider quarantining them so that you don't propagate the illness further, especially to people that are at higher risk. In New York City, almost every other person has a dog or a pet. And it's important to recognize that there is some transmission from pet owners to pets, but there's not thought to be a significant reservoir from pets to owners. But it's important to treat your pet like any other member of your family. So if you're feeling sick, you should try to isolate from your dog or your pet as well, because you can still get them sick. And some cats and dogs have tested positive. And if you're thinking about going to a dog park this summer, please keep in mind that if you are sick or your dog has been sick or anybody has tested positive, you should try to prevent anyone outside of the household from interacting with your dog. And it's an important feature of socialization, but I would try to minimize those features if possible to prevent additional propagation and spread and to keep this extra member of your family healthy. Finally, what about water? Can we get coronavirus through swimming in a pool, through being in a hot tub with somebody, or through being in the ocean? Unfortunately, unless you're within 6 feet of somebody, just like it would be if you're not in the water, there's no evidence that this spreads through the water. So you don't really have to worry about that. 3, preventive measures. Community transmission, we know, is much less and better controlled if we have social distancing, hand hygiene, and using face cloths or face shields. So let's review quickly the importance of hand hygiene and how we can use it appropriately. So first, let's go ahead and grab your hand sanitizer. Oh, sorry, wrong one. Here it is, hand sanitizer. Okay, the most important feature about a hand sanitizer is that it's 60% alcohol or higher. So looking at this one, this is 75% alcohol content, and it should be prominently displayed in the label. And then you take a little bit, you put it in the palm of your hand, and then you rub your hands together until they are completely dry, and you make sure that you go over every single surface, and this is best if your hands are not visibly soiled. You can shake off any excess if it's there, wait 30 seconds, and then you can go ahead and touch your face if you need to. But I would avoid touching your phone or some other object after hand sanitizer, because unless you've cleaned that object first, you can still transmit the virus, okay? And then in terms of washing your hands, you want to wet your hand first, and then you want to get the soap and you want to rub for at least 20 seconds in between all crevices of your hand, and then you proceed to wash your hands off and try to dry. If you can air dry without touching anything, that's even better. In terms of face cloths or face shields, the CDC recommends saving medical masks or medical grade masks for healthcare workers. And all you really need is something that's the consistency of a dishcloth. And if you double layer that, it approaches the efficiency of a medical mask anyway. But the important feature is if you don't cover your nose and your mouth at the same time, then you're not preventing transmission of whatever you're carrying to other people. And those respiratory droplets can still spread. And the point of this mask is to prevent others from getting whatever you have, not the other way around. What about therapy? This is one of the hottest topics, and the entire medical community is actively searching for the drug that can help people with COVID-19. And although we've had some success with medications in the hospital, which if you've been in the hospital, you may have been offered one of these, there's currently no effective and helpful, safe treatment options available in the clinic right now outside of a clinical trial. So although there's lots of hope for this, and we're all desperately searching for some type of possible solution, you have to be safe above everything else, and as a medical community, it's our goal to keep you safe above trying to offer therapies that might be potentially dangerous to you. So it's difficult, but we're still working together to try to figure out a safe, effective option, and many trials are ongoing. I want to share some final thoughts, because it's hard to ignore the gross injustice that happened recently and has been going on in the country for years and years. And as a member of the medical community, I became a doctor so that I can help other people, I can help generations of families, and that we can fight together disease side by side, and that when someone is most vulnerable, we can reach out a hand and provide them with any source of comfort and any source of improved care that we can. And I'll stand alongside anybody that fights against the structural racism that's so prevalent in the country today. And if there's any way that I can provide additional resources for you or your family or your loved ones, please let me know, because no one should not have access to great health care, and this should not be an exception in any scenario. And I don't care about your race, your gender, your sexual orientation, where you come from or where you're going. It's a basic right and not a privilege, and everyone deserves the same. Well, I hope this was a great high-level overview of what we know right now about COVID-19 this summer and what you can do to protect yourself, your family, and your loved ones, including your pets. Subscribe below, and next week I'm going to talk about antibody testing and what you can do to interpret the results appropriately. If there's anything you want to know more about or that you'd like me to answer, please comment below or send me an email at rbobermd@gmail.com. And I'll see you in clinic next week.